Question 1. Operational review demonstrates that a pregnant individual at 12 weeks gestation has inadvertently taken a medication not typically prescribed during pregnancy. The healthcare provider requests immediate guidance on potential teratogenic effects and maternal health implications. Which of the following represents the most appropriate immediate action for a specialist in poison information, SPI, in the UK? Option A. Rely on personal clinical experience and anecdotal reports regarding the medication's effects in pregnant individuals. Option B. Provide general toxicology information from a standard drug reference book, assuming the risks are similar to non-pregnant adults. Option C. Advise the healthcare provider to wait until after the pregnancy is completed to gather more definitive information on the medication's effects. Option D. Consult the UK Teratology Information Service, UCTI's, database and relevant peer-reviewed literature for the specific medication, assessing the known risks to fetal development and maternal health at the current gestational age. Correct answer is D. Consult the UK Teratology Information Service, UCTI's, database and relevant peer-reviewed literature for the specific medication, assessing the known risks to fetal development and maternal health at the current gestational age. Explanation. This scenario is professionally challenging due to the inherent complexity of managing potential teratogenic exposures in pregnant individuals. The critical need to balance maternal health with fetal well-being, coupled with the often limited and evolving scientific data on specific exposures during pregnancy, demands meticulous judgment. Professionals must navigate uncertainty, communicate risks effectively, and adhere to established protocols to ensure the best possible outcomes for both mother and child. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment tailored to the individual patient. This involves consulting up-to-date, reliable resources specifically designed for toxicology in pregnancy, such as the UK Teratology Information Service, UCTI's, or equivalent National Poison Control Center databases, which are mandated by regulatory frameworks governing specialist poison information. It emphasizes a thorough risk-benefit analysis, considering the stage of gestation, the dose and duration of exposure, and the availability of safer alternatives. This aligns with the ethical duty of care and the regulatory requirement to provide accurate, current, and relevant information to healthcare professionals managing these complex cases. An incorrect approach that relies solely on general toxicology databases without specific pregnancy considerations fails to meet the regulatory standard for specialist poison information. These general databases may not adequately address the unique pharmacokinetic and pharmacodynamic changes that occur during pregnancy, nor the specific teratogenic potential of substances. This oversight can lead to the provision of misleading or incomplete information, potentially resulting in inappropriate management decisions that could harm the fetus. Another incorrect approach that involves delaying consultation with a specialist poison information service until after the pregnancy is complete is a significant regulatory and ethical failure. The critical window for intervention and management of potential teratogenic effects is during the pregnancy itself. Postponing expert consultation deprives the pregnant individual and their healthcare provider of timely, accurate advice, thereby forfeiting opportunities to mitigate risks or implement necessary monitoring and interventions. This contravenes the principle of prompt and effective patient care. Furthermore, an approach that dismisses the concern based on anecdotal evidence or personal experience without consulting validated resources is professionally unacceptable. Specialist poison information requires adherence to scientific evidence and established protocols, not subjective interpretation. This disregard for evidence-based practice can lead to underestimation of risks and potentially catastrophic outcomes for the fetus. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the exposure and the pregnant individual's clinical status. 2. Immediately consult specialized, up-to-date resources for toxicology in pregnancy. 3. Assess the specific risks based on the substance, dose, duration, and gestational age. 4. Consider maternal health factors and potential interactions. 5. Communicate findings and recommendations clearly to the healthcare provider, emphasizing the uncertainties and the rationale behind the advice. 6. Document the consultation and recommendations thoroughly. Question 2. The assessment process reveals a report of a patient experiencing nausea and vomiting shortly after ingesting a cleaning product containing ammonia. The patient also reports a burning sensation in their throat. Based on the initial information, which classification best describes the primary toxicological presentation of this exposure? Option A, chronic systemic. Option B, chronic local. Option C, acute local. Option D, acute systemic. The correct answer is C, acute local. Explanation: this scenario is professionally challenging because accurately classifying a poison's effects is fundamental to providing appropriate and timely poison information. Misclassification can lead to delayed or incorrect treatment recommendations, potentially impacting patient outcomes. Specialists in poison information, SPI, must apply their knowledge of toxicology and regulatory guidelines to differentiate between acute and chronic, and systemic versus local effects, even when presented with incomplete or ambiguous information. The correct approach represents best professional practice because it aligns with the core responsibilities of an SPI as defined by regulatory frameworks and professional guidelines. Specifically, it requires a thorough understanding of the temporal nature of poison exposure, acute vs. chronic, and the site of action, systemic vs. local. This detailed classification allows for precise communication of risks and appropriate guidance to healthcare professionals or the public, ensuring that interventions are targeted and effective. Adherence to these classifications is implicitly or explicitly mandated by guidelines that emphasize accurate information dissemination for public health and safety. An incorrect approach that focuses solely on the route of exposure without considering the temporal aspect or the target organ system fails to meet the comprehensive requirements of poison classification. This is a regulatory and ethical failure because it oversimplifies a complex toxicological assessment, potentially leading to a mischaracterization of the hazard. For instance, classifying a substance solely as ingested ignores whether the effects are immediate and severe, acute, or cumulative over time, chronic, and whether it affects the entire body, systemic, or just the gastrointestinal tract, local. This lack of depth in classification can result in inappropriate advice, such as recommending immediate emergency care for a substance with only mild local irritant effects, or conversely, downplaying the severity of a chronic systemic toxin. Another incorrect approach that prioritizes only the severity of symptoms without considering the duration or target of the poison is also professionally unacceptable. Severity is a crucial factor, but it must be contextualized within the acute/chronic and systemic/local framework. A severe local reaction might be managed differently than a severe systemic reaction, and the management of acute poisoning differs significantly from chronic exposure. Failing to make these distinctions is a failure to adhere to established toxicological principles and regulatory expectations for comprehensive poison information. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather all available information about the exposure, including the substance, amount, route, and time of exposure. 2. Assess the temporal characteristics. Is the exposure a single event or repeated over time? This helps determine acute versus chronic. 3. Evaluate the target of the poison's action. Does it affect specific tissues or organs locally, or is it distributed throughout the body causing widespread effects? This differentiates local versus systemic. 4. Synthesize this information to arrive at the most accurate classification. 5. Communicate this classification clearly and concisely, along with appropriate risk assessment and management recommendations, adhering to all relevant regulatory and ethical standards. Question 3. Process analysis reveals a patient presents to the emergency department following ingestion of an unknown substance. The patient is alert and oriented, reporting mild nausea and a slight tremor. The Poison Control Center has been consulted. Considering the limited information and the need for efficient and effective patient care, which of the following laboratory evaluations is most appropriate as an initial step to guide further management? Option A. A chest X-ray and an abdominal CT scan to rule out internal injuries. Option B. A complete blood count and urinalysis to assess for general systemic effects. Option C. Immediate administration of activated charcoal and observation for 24 hours without laboratory testing. Option D. A comprehensive metabolic panel and a toxicology screen for common illicit drugs and prescription medication. The correct answer is D. A comprehensive metabolic panel and a toxicology screen for common illicit drugs and prescription medications. Explanation: scenario analysis. This scenario presents a challenge in a specialist in poison information SPI, role by requiring the application of laboratory evaluation principles in a complex clinical context. The difficulty lies in discerning the most appropriate diagnostic pathway when presented with a patient exhibiting nonspecific symptoms following a potential exposure, necessitating a balance between timely intervention and avoiding unnecessary investigations. The SPI must consider the toxicological profile of the suspected agent, the patient's clinical presentation, and the diagnostic utility of various laboratory and imaging studies within the established regulatory framework. Correct approach analysis. The correct approach prioritizes a targeted laboratory evaluation based on the suspected toxicological agent and the patient's clinical signs and symptoms. This aligns with best professional practice by ensuring that diagnostic efforts are focused, cost-effective, and provide the most relevant information for patient management. In the context of the specialist in poison information, SPI, role, this involves leveraging knowledge of toxicology to predict likely metabolic pathways, target organs, and characteristic laboratory abnormalities associated with specific poisons. This approach is ethically sound as it avoids exposing the patient to the risks and costs of unnecessary procedures, while maximizing the potential for accurate diagnosis and timely treatment. Regulatory guidelines for SPIs emphasize evidence-based practice and the judicious use of diagnostic resources. Incorrect approaches analysis. One incorrect approach would be to order a broad, non-specific panel of laboratory tests without a clear hypothesis regarding the poison. This is professionally unacceptable because it represents a shotgun approach that is unlikely to yield definitive diagnostic information for a specific poisoning. It can lead to a delay in identifying the true culprit, increased patient risk from unnecessary blood draws, and significant financial waste, potentially violating principles of resource stewardship and patient care efficiency. Another incorrect approach would be to rely solely on imaging studies without initial laboratory investigations. While imaging can be crucial in certain poisoning scenarios, e.g., to identify foreign bodies or organ damage, it is often not the primary diagnostic tool for detecting the presence or concentration of most toxins. This approach fails to directly address the core toxicological question and may miss critical biochemical markers of toxicity, leading to delayed or incorrect management. Ethically, it prioritizes a potentially less informative diagnostic modality over more direct toxicological assessments. A third incorrect approach would be to dismiss the need for any laboratory evaluation based on a seemingly mild initial presentation. This is a dangerous oversight. Many toxins can have delayed or subtle onset of severe toxicity, and initial symptoms may not correlate with the overall severity of poisoning. Failing to conduct appropriate laboratory tests when indicated by the exposure history or subtle clinical signs can lead to misdiagnoses and catastrophic outcomes, representing a failure to uphold the duty of care expected of an SPI. Professional reasoning. Professionals in the SPI role should employ a systematic decision-making framework. This begins with a thorough assessment of the exposure history, including the substance, route, amount, and time of exposure. This is followed by a comprehensive evaluation of the patient's signs and symptoms. Based on this information, the SPI should formulate a differential diagnosis of potential toxins. The next step involves determining the most appropriate diagnostic strategy, which may include targeted laboratory tests, e.g., specific drug screens, electrolyte panels, liver function tests, blood gas analysis, or imaging studies, prioritizing those that will most effectively confirm or refute the suspected diagnosis and guide management. Consultation with medical toxicologists or other healthcare professionals is also a critical component of this framework when uncertainty exists. Question 4. Investigation of a 45-year-old male presenting to the emergency department with sudden onset of confusion, muscle weakness, and a rapid, irregular heartbeat following ingestion of an unknown substance approximately 2 hours prior. The patient's family reports he was experiencing significant stress and may have consumed something from his workshop. Initial vital signs are unstable. Considering the potential for rapid systemic effects, which of the following is the most critical initial step in guiding the poison information specialist's assessment and recommendations? Option A. Investigating the substance's primary routes of excretion and the potential for accumulation in the body. Option B. Evaluating the substance's known metabolic pathways and the potential for active or toxic metabolites. Option C. assessing the substance's distribution characteristics, including its affinity for specific tissues and its ability to cross the blood-brain barrier. Option D, determining the substance's primary route of absorption and its rate of entry into the bloodstream. The correct answer is D, determining the substance's primary route of absorption and its rate of entry into the bloodstream. Explanation: this scenario presents a professional challenge due to the rapid onset of symptoms and the need for immediate, accurate poison information to guide clinical management. The complexity arises from the potential for multiple mechanisms of toxicity to be at play, requiring a nuanced understanding of how a substance is absorbed, distributed, metabolized, and excreted to predict its effects and recommend appropriate interventions. Careful judgment is required to differentiate between expected toxicokinetics and unusual presentations, ensuring patient safety. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the patient's presentation in the context of the suspected poison's known properties. This aligns with the core responsibilities of a specialist in poison information, SPI, as outlined by regulatory frameworks, which mandate the provision of accurate and timely information to healthcare professionals. By considering the interplay of absorption, distribution, metabolism, and excretion, the SPI can anticipate the duration and severity of toxicity, identify potential target organs, and suggest appropriate supportive care or antidotal therapy. This approach is ethically sound, ensuring the patient receives the most effective and safest possible management based on the best available scientific understanding. An incorrect approach that focuses solely on a single aspect of toxicity, such as only absorption, without considering how the substance is subsequently handled by the body, is professionally unacceptable. This failure to consider the complete toxicokinetic profile can lead to an incomplete or inaccurate assessment of the patient's risk. For instance, a substance that is rapidly absorbed but also rapidly metabolized and excreted might pose a less severe or prolonged threat than one that is slowly absorbed but extensively distributed and poorly eliminated. Ignoring distribution could lead to underestimating systemic effects, while neglecting metabolism and excretion might result in overestimating the immediate danger or failing to anticipate delayed toxicity. Such an incomplete analysis could result in inappropriate treatment recommendations, potentially leading to patient harm and violating professional standards of care and regulatory expectations for comprehensive poison information. Another incorrect approach might involve relying on anecdotal evidence or outdated information. The field of toxicology is constantly evolving with new research. Professional decision-making requires a commitment to continuous learning and the use of current, peer-reviewed data. Relying on outdated knowledge or unverified information can lead to the application of ineffective or even harmful interventions, directly contravening the SPI's duty to provide accurate and up-to-date guidance. This failure to adhere to current scientific understanding represents a significant regulatory and ethical lapse. The professional decision-making process for similar situations should involve 1. Rapidly gathering all available patient information, symptoms, route of exposure, estimated dose, time of exposure, patient's medical history. 2. Identifying the suspected poison, and accessing reliable, up-to-date toxicological databases and literature. 3. Systematically evaluating the poison's known absorption, distribution, metabolism, and excretion characteristics. 4. Correlating these toxicokinetic properties with the patient's clinical presentation to predict the likely course of toxicity. 5. Formulating evidence-based recommendations for management, including supportive care, decontamination, antidotes, and monitoring. 6. Communicating this information clearly and concisely to the requesting healthcare professional, being prepared to answer follow-up questions and provide further support. Question 5. What factors determine the optimal sequence and selection of decontamination, antidote administration, and supportive care in the management of an acute poisoning presentation, considering the specific toxicological profile and patient's physiological status? Option A. The patient's personal preferences, the perceived severity of the poisoning based on anecdotal reports, and the ease of administering a particular treatment. Option B. The patient's insurance coverage, the hospital's formulary, and the time of day the poisoning occurred. Option C. The cost-effectiveness of different decontamination methods, the patient's social support system, and the physician's prior experience with similar cases. Option D. The availability of specific antidotes, the patient's clinical signs and symptoms of toxicity, and the route and estimated quantity of exposure. The correct answer is D. The availability of specific antidotes, the patient's clinical signs and symptoms of toxicity, and the route and estimated quantity of exposure. Explanation. This scenario is professionally challenging because managing acute poisoning requires rapid, evidence-based decision-making under pressure, often with incomplete patient information. The specialist in poison information, SPI, must synthesize complex toxicological data with patient-specific factors to guide appropriate interventions, balancing efficacy with potential harm. The regulatory framework for SPIs, as defined by insert-specific jurisdiction's regulatory body, e.g., the U.S. Pharmacopoeia USP, General Chapter 797 for compounding sterile preparations, or relevant National Poison Control Center guidelines, mandates adherence to established protocols and best practices to ensure patient safety and optimize outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the poisoned individual and the specific toxicant. This includes evaluating the route of exposure, the quantity ingested or absorbed, the time since exposure, and the patient's clinical presentation and comorbidities. Based on this thorough evaluation, the SPI can then recommend the most appropriate decontamination methods, if indicated and safe. The judicious use of specific antidotes, considering their efficacy, availability, and potential adverse effects, and the necessary supportive care to manage life-threatening symptoms. This systematic, patient-centered approach aligns with the ethical obligation to provide competent care and the regulatory requirement to follow evidence-based guidelines for poison management. Incorrect approaches are professionally unacceptable due to their potential to cause harm and their deviation from established standards of care. Relying solely on a generic protocol without considering individual patient factors can lead to inappropriate or delayed interventions. For instance, administering activated charcoal to a patient with an unprotected airway or a bowel obstruction would be contraindicated and could lead to serious complications, violating the principle of do no harm and failing to meet the standard of care expected of an SPI. Similarly, administering an antidote without a clear indication, or when it poses a greater risk than benefit, would be a significant ethical and regulatory failure, potentially leading to iatrogenic harm. Failing to provide adequate supportive care for critical symptoms like respiratory depression or hemodynamic instability would also constitute a breach of professional duty and regulatory expectations. Professional decision-making in similar situations requires a structured approach. 1. Rapidly gather all available information about the patient and the suspected poison. 2. Consult reliable, up-to-date poison information resources and establish treatment guidelines relevant to the specific jurisdiction. 3. Critically evaluate the risks and benefits of each potential intervention, considering the patient's unique clinical status. 4. Communicate clearly and concisely with healthcare providers, providing actionable recommendations. 5. Continuously reassess the patient's condition and adjust management strategies as needed. This process ensures that interventions are tailored, safe, and effective, upholding the highest standards of poison information practice. Question 6. When evaluating a conscious and alert adult patient who has ingested a life-threatening dose of a toxin for which a specific antidote is available, but the patient adamantly refuses administration of the antidote due to a deeply held personal belief that it is against their spiritual principles, what is the most ethically and professionally appropriate course of action for the specialist in poison information, SPI? Option A. Contact the patient's family or friends to persuade them to convince the patient to accept the antidote, as their well-being is at stake. Option B. Attempt to understand the patient's beliefs and concerns, assess their capacity to refuse treatment, and provide comprehensive information about the antidote's benefits, risks, and the consequences of refusal, while respecting their final decision if they remain competent. Option C. Document the patient's refusal and withdraw from further involvement, as the patient's wishes are paramount and cannot be overridden. Option D. Administer the antidote immediately, as the life-saving potential outweighs the patient's stated refusal, given the severity of the poisoning. The correct answer is B. Attempt to understand the patient's beliefs and concerns, assess their capacity to refuse treatment, and provide comprehensive information about the antidote's benefits, risks, and the consequences of refusal, while respecting their final decision if they remain competent. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the potential for a life-saving intervention, complicated by the availability of an antidote with known risks. As a specialist in poison information, SPI, the professional must navigate ethical principles of patient autonomy, beneficence, and non-maleficence, all within the strict regulatory framework governing medical practice and the use of pharmaceuticals. The urgency of the situation, coupled with the limited information and the potential for irreversible harm, necessitates careful judgment. The correct approach represents best professional practice because it prioritizes a thorough, albeit rapid, assessment of the patient's capacity to make informed decisions and seeks to understand the underlying reasons for their refusal. This aligns with the ethical principle of respect for autonomy, which mandates that competent individuals have the right to refuse medical treatment, even if that refusal may lead to serious consequences. Furthermore, it upholds the principle of beneficence by attempting to provide the patient with all necessary information to make a truly informed decision, addressing their concerns and exploring alternatives. This approach is supported by professional guidelines that emphasize patient-centered care and shared decision-making, ensuring that interventions are not imposed but are rather agreed upon. An incorrect approach that involves administering the antidote without further assessment or discussion would represent a significant ethical and regulatory failure. It violates the principle of autonomy by overriding the patient's expressed wishes, potentially leading to a battery claim. Ethically, it moves from beneficence to potential harm by administering a treatment against the patient's will, disregarding their right to self-determination. This also fails to adhere to regulatory requirements for informed consent, which are fundamental to all medical interventions. Another incorrect approach, that of immediately deferring to the patient's refusal without any attempt to understand their reasoning or assess their capacity, would also be professionally unacceptable. While respecting autonomy is crucial, a complete abdication of professional responsibility to ensure the patient is fully informed and capable of making such a decision would be a failure of beneficence and potentially non-maleficence. The SPI has a duty to provide accurate information about the risks and benefits of the antidote and to ensure the patient comprehends this information. Without this, the patient's refusal may not be truly informed, and the SPI would be failing in their duty to protect the patient's well-being. The professional decision-making process in such situation should involve a rapid, yet comprehensive, assessment of the patient's capacity to consent or refuse. This includes evaluating their understanding of the situation, the proposed treatment, the antidote, its benefits, risks and alternatives, and the consequences of refusal. If capacity is present, the professional must engage in a dialogue to understand the patient's concerns and values, providing clear and unbiased information. If capacity is questionable, the professional must follow established protocols for assessing and managing incapacity, which may involve seeking legal or ethical consultation and involving surrogate decision-makers. Throughout this process, maintaining clear and accurate documentation of all assessments, discussions, and decisions is paramount. Question 7. Stakeholder feedback indicates that some SPIs are struggling to differentiate between common poisonings that present with overlapping or subtle clinical signs and those that are not poisonings at all. In a scenario where a patient presents with generalized weakness, nausea, and a slight tremor, and the suspected exposure is to a common household cleaning product, what is the most appropriate initial approach for an SPI to guide further management? Option A. Suggest a combination of continued clinical observation for evolving signs and symptoms, alongside targeted laboratory testing for specific components of the suspected cleaning product if indicated by the clinical picture and available resources. Option B. Advise the healthcare provider to focus solely on symptomatic treatment for the nausea and weakness, assuming the tremor is unrelated to the exposure. Option C. Inform the healthcare provider that without classic signs of severe poisoning, no further investigation or specific treatment is warranted. Option D. Recommend immediate administration of a broad-spectrum antidote for common household toxins while awaiting laboratory results. The correct answer is D. Recommend immediate administration of a broad-spectrum antidote for common household toxins while awaiting laboratory results. Explanation. Scenario analysis. This scenario presents a common challenge for a specialist in poison information, SPI, where a definitive diagnosis is not immediately apparent and the patient's presentation is complex. The professional challenge lies in balancing the urgency of potential poisoning with the need for accurate identification to guide appropriate treatment and prevent unnecessary interventions. The SPI must consider the limitations of initial clinical assessment and the value of laboratory confirmation, all while adhering to established protocols and guidelines for poison management. The pressure to act quickly without compromising patient safety or misallocating resources necessitates a systematic and evidence-based approach. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that integrates clinical observation with laboratory confirmation. This aligns with best professional practice by acknowledging that clinical signs and symptoms, while crucial for initial management, can be nonspecific or mimic other conditions. Relying solely on clinical presentation risks misdiagnosis and delayed or inappropriate treatment. Laboratory methods, when available and appropriate, provide objective data to confirm or refute suspected poisonings, enabling targeted interventions and accurate prognosis. This approach is ethically sound as it prioritizes patient well-being through accurate diagnosis and treatment, and it is regulatory compliant by adhering to established guidelines for poison identification and management, which often advocate for a combination of clinical and laboratory assessment where indicated. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's reported symptoms and the initial clinical examination without considering further diagnostic steps. This fails to acknowledge the potential for symptom overlap with other medical conditions and the limitations of subjective reporting. Ethically, this could lead to a failure to identify the true cause of the patient's distress, potentially resulting in delayed or incorrect treatment. Regulatory failure would occur if established protocols for suspected poisonings mandate further investigation when clinical suspicion is high. Another incorrect approach would be to immediately initiate aggressive, broad-spectrum antidotal therapy based solely on a suspicion of a common poison, without definitive laboratory confirmation or a clear clinical indication. While rapid intervention is sometimes necessary, indiscriminate use of antidotes can lead to adverse effects, mask the true diagnosis, and be costly. This approach is ethically questionable due to the potential for iatrogenic harm and regulatory noncompliance if treatment protocols require evidence-based justification. A third incorrect approach would be to dismiss the possibility of poisoning due to the absence of classic, textbook symptoms. Many poisonings present with atypical or subtle signs, and a skilled SPI must maintain a high index of suspicion when appropriate. This approach risks overlooking a serious poisoning, leading to severe patient harm and a breach of professional duty. Professional reasoning. When faced with a suspected poisoning, the professional decision-making process should involve 1. Initial assessment. Gather comprehensive information on the patient's history, symptoms, and potential exposures. 2. Clinical correlation. Evaluate the presenting signs and symptoms against known toxicological profiles of common agents. 3. Risk stratification. Determine the severity of the situation and the urgency of intervention. 4. Diagnostic strategy. Consider the utility of laboratory testing to confirm or refute suspected poisonings, taking into account the availability of tests, turnaround times, and the potential impact on patient management. 5. Treatment planning. Develop a treatment plan that is guided by both clinical assessment and, where available, laboratory findings. 6. Reevaluation. Continuously monitor the patient's condition and adjust the diagnostic and treatment strategies as new information becomes available. This systematic approach ensures that decisions are evidence-based, patient-centered, and compliant with professional standards and regulatory requirements. Question 8. The efficiency study reveals that the average time spent on each poison information inquiry has increased by 15% over the last quarter, prompting management to suggest implementing a new protocol that limits the number of external resources. An SPI can consult per case to a maximum of 3, aiming to reduce call handling times. As a specialist in poison information, SPI, you are concerned that this restriction could compromise the accuracy and completeness of the advice provided, particularly for complex or rare exposures involving multiple classes of poisons. Which of the following approaches best upholds your professional and ethical obligations? Option A. Implement the new protocol immediately to demonstrate compliance with management's directive, assuming that most common inquiries can still be adequately addressed within the new limits. Option B. Delegate the responsibility of determining which 3 external resources are most relevant to less experienced staff members to expedite the process, trusting their judgment. Option C. Politely but firmly explain to management that while efficiency is important, the proposed protocol could compromise patient safety by limiting access to critical information, and advocate for alternative efficiency measures that do not restrict the depth of research. Option D. Suggest to management that SPIs should be trained to rely more heavily on memory and less on external resources to improve efficiency, even if it means occasionally providing less detailed information. The correct answer is C. Politely but firmly explain to management that while efficiency is important, the proposed protocol could compromise patient safety by limiting access to critical information, and advocate for alternative efficiency measures that do not restrict the depth of research. Explanation. This scenario presents a professional challenge due to the inherent conflict between resource optimization and the paramount duty of patient care and accurate poison information dissemination. The pressure to increase efficiency, as highlighted by the study, could inadvertently lead to a reduction in the thoroughness of information provided, potentially compromising patient safety. The specialist in poison information, SPI, must navigate this by upholding professional standards and regulatory requirements that prioritize accuracy and comprehensive advice over speed or cost-saving measures that might dilute the quality of service. The correct approach represents best professional practice because it prioritizes the core mandate of the SPI role, providing accurate, evidence-based, and comprehensive poison information. This aligns with the ethical obligation to act in the best interest of the patient and the public. Adherence to established protocols for information retrieval and dissemination, even if they are perceived as less efficient, ensures that all relevant factors are considered, minimizing the risk of misdiagnosis or inappropriate treatment recommendations. This approach upholds the integrity of the Poison Information Service and maintains public trust, which is a cornerstone of regulatory compliance and professional responsibility. An incorrect approach that focuses solely on speed without ensuring complete information gathering would represent a significant regulatory and ethical failure. This could lead to overlooking critical details about the poison, the patient's condition, or potential interactions, thereby violating the duty of care. Such an approach could also contravene guidelines that mandate thoroughness and accuracy in all communications, potentially leading to adverse patient outcomes and disciplinary action. Another incorrect approach, which involves delegating complex information verification to less experienced staff without adequate oversight, also constitutes a regulatory and ethical failure. SPI has a professional responsibility to ensure the accuracy of all information provided by the service. Delegating without proper supervision or training can lead to errors that are not caught, again jeopardizing patient safety and violating professional standards. The professional decision-making process for similar situations should involve a clear understanding of the SPI's ethical obligations and regulatory responsibilities. When faced with efficiency pressure, the SPI must first assess the potential impact on the quality and accuracy of information. If efficiency measures threaten these core principles, the SPI must advocate for alternative solutions that do not compromise patient care. This involves clear communication with management, referencing professional standards and regulatory requirements, and proposing strategies that balance efficiency with the non-negotiable need for accurate and comprehensive poison information. The decision-making framework should always begin with what is in the best interest of the patient and the public, and what are the regulatory requirements for providing this information. Question 9. The monitoring system demonstrates an unusual spike in calls related to respiratory distress and neurological symptoms, coinciding with the detection of an unknown airborne particulate matter in a localized area. Which of the following represents the most appropriate immediate course of action for a specialist in poison information, SPI? Option A. Classify the event as a potential false positive from the monitoring system and await further data before taking any action, given the unknown nature of the particulate matter. Option B. Advise the public to seek immediate medical attention if they experience any respiratory or neurological symptoms, without specifying the cause or providing further guidance on potential exposures. Option C. Immediately issue a broad public health alert for a potential chemical attack, advising residents to shelter in place and avoid outdoor activities based on the initial symptom cluster. Option D. Initiate a comprehensive toxicological analysis of the airborne, particulate matter and cross-reference findings with known chemical and biological agents. while simultaneously assessing the geographic distribution and temporal pattern of reported symptoms to identify potential exposure pathways. Correct answer is D. Initiate a comprehensive toxicological analysis of the airborne, particulate matter and cross-reference findings with known chemical and biological agents, while simultaneously assessing the geographic distribution and temporal pattern of reported symptoms to identify potential exposure pathways. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the specialist in poison information, SPI, to interpret complex, real-time data from a monitoring system and make a critical judgment about the potential for widespread harm from a novel poisonous agent. The novelty of the agent means established protocols might be insufficient, demanding a proactive and analytical approach. The SPI must balance the urgency of a potential public health threat with the need for accurate information to guide response efforts, avoiding both overreaction and underestimation of risk. Correct approach analysis. The correct approach involves a systematic evaluation of the monitoring system's data, focusing on identifying patterns, anomalies, and potential causal links to the suspected poisonous agent. This includes cross-referencing with available toxicological databases, scientific literature, and expert consultation, even if preliminary. The SPI must prioritize confirming the presence and nature of the agent, assessing its potential routes of exposure, and estimating the severity of potential health effects. This aligns with best practices for poison information specialists, emphasizing evidence-based assessment and risk stratification. Regulatory frameworks for poison control centers, such as those overseen by the U.S. Food and Drug Administration, FDA, and the American Association of Poison Control Centers, APC, guidelines, mandate accurate and timely information dissemination and the development of appropriate management strategies based on the best available scientific evidence. This approach ensures that interventions are targeted and effective, minimizing unnecessary alarm or resource misallocation. Incorrect approach is analysis. One incorrect approach involves immediately escalating to a full public health alert based solely on the initial detection of an unusual substance, without further characterization. This fails to meet the regulatory expectation of evidence-based decision-making and could lead to public panic and unnecessary strain on emergency services, violating the ethical principle of proportionality in risk communication. Another incorrect approach is to dismiss the findings as a system error or insignificant anomaly without thorough investigation. This poses a significant regulatory and ethical failure, as it neglects the potential for a genuine public health threat, contravening the SPI's duty to protect public health and potentially violating reporting requirements to relevant health authorities. A third incorrect approach is to rely solely on anecdotal reports or unverified sources to assess the agent's toxicity. This lacks scientific rigor and is contrary to the established professional standards for poison information, which require reliance on validated data and expert toxicological assessment, as outlined by professional bodies and regulatory oversight. Professional reasoning. Professionals should approach such situations by first establishing a clear understanding of the monitoring system's capabilities and limitations. They should then initiate a multi-pronged investigation, data validation, agent identification, exposure assessment, and toxicity evaluation. This process should be iterative, with findings from one step informing the next. Collaboration with other experts, such as toxicologists, epidemiologists, and public health officials, is crucial. The decision to escalate or disseminate information should be based on a predefined risk assessment framework, considering the likelihood and severity of harm. Continuous monitoring and reevaluation of the situation are essential as new information becomes available. Question 10. Risk assessment procedures indicate a suspected poisoning has occurred, and the patient, while conscious, appears disoriented and is accompanied by a concerned individual who claims to be a close friend and insists on providing a detailed history of the patient's actions leading up to the incident, stating the patient is too confused to recall accurately. The specialist in poison information, SPI, must determine the most appropriate initial step in gathering clinical information. Option A. Share the patient's medical information with the accompanying individual to facilitate their provision of a history, assuming they have the patient's best interests at heart. Option B. Immediately disregard the accompanying individual's input and focus solely on obtaining a history directly from the patient, regardless of their apparent disorientation. Option C. Prioritize obtaining the full history from the accompanying individual, as their insistence suggests they possess crucial information that could expedite treatment. Option D. Attempt to obtain the patient's consent to speak with the accompanying individual, while also assessing the patient's capacity to provide their own history. The correct answer is D. Attempt to obtain the patient's consent to speak with the accompanying individual, while also assessing the patient's capacity to provide their own history. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between patient autonomy and the duty to protect a potentially vulnerable individual. The specialist in poison information, SPI, must navigate the ethical imperative to gather comprehensive clinical information for accurate assessment and treatment, while respecting the patient's right to privacy and potentially their desire to withhold information. The presence of a third party, who may have ulterior motives or a biased perspective, further complicates the history-taking process, requiring careful discernment and verification of information. The SPI must balance the urgency of a potential poisoning with the need for a thorough and ethically sound approach. Correct approach analysis. The correct approach prioritizes direct, uncoerced communication with the patient while acknowledging the potential value of collateral information. It involves attempting to obtain consent for information sharing from the patient, recognizing that their capacity to consent may be impaired due to the suspected poisoning. If consent cannot be obtained or is questionable, the SPI must then ethically consider the necessity of the information for immediate patient safety and the availability of alternative, less intrusive methods of information gathering. This approach aligns with professional ethical guidelines that emphasize patient well-being, informed consent, and the principle of beneficence, while also respecting patient confidentiality and autonomy as much as possible within the constraints of the situation. It also reflects the regulatory framework's expectation of a thorough clinical assessment, which may necessitate careful and judicious inquiry. Incorrect approaches analysis. An approach that immediately dismisses the patient's wishes and solely relies on the third party's account, without attempting to assess the patient's capacity or obtain consent, would be an ethical and regulatory failure. This disregards patient autonomy and the principle of informed consent, potentially leading to a breach of confidentiality and a violation of the patient's rights. It also risks obtaining biased or inaccurate information, compromising the clinical assessment. An approach that solely focuses on the patient and completely ignores the third party, even when the patient's condition is deteriorating or their ability to provide a complete history is compromised, could also be problematic. While patient autonomy is paramount in a critical poisoning scenario, failing to gather all potentially life-saving information, even from a reliable collateral source, could be seen as a failure of the duty of care and beneficence, potentially leading to suboptimal patient outcomes. This would be a regulatory failure if it deviates from established protocols for comprehensive poisoning assessment. An approach that involves sharing patient information with the third party without the patient's explicit consent, even if the SPI suspects the third party has the patient's best interests at heart, is a direct violation of patient confidentiality and privacy regulations. This erodes trust and can have significant legal and ethical repercussions. Professional reasoning. Professionals should employ a structured decision-making process that begins with assessing the patient's immediate stability and capacity. If the patient is stable and capable, their wishes regarding information sharing should be respected, with efforts made to obtain consent for any collateral information. If capacity is questionable or the patient is unstable, the SPI must ethically weigh the urgency of the situation against the need for consent, prioritizing life-saving interventions and information gathering while minimizing breaches of privacy. This involves a continuous assessment of the situation, seeking to balance competing ethical principles and regulatory requirements. Question 11. Market research demonstrates a growing need for rapid and accurate information regarding the mechanisms of action of common antidotes. A specialist in poison information, SPI, is presented with a scenario involving a suspected overdose and needs to quickly differentiate the primary pharmacological actions of naloxone, activated charcoal, and atropine. Which of the following accurately describes the principal mechanism of action for each of these antidotes? Option A. Naloxone competitively antagonizes opioid receptors. Activated charcoal absorbs toxins in the gastrointestinal tract. Atropine blocks muscarinic acetylcholine receptors. Option B. Naloxone is a gastrointestinal adsorbent. Activated charcoal competitively antagonizes opioid receptors. Atropine is a dopamine antagonist. Option C. Naloxone acts as a GABA receptor agonist. Activated charcoal is a receptor antagonist. Atropine enhances acetylcholine release. Option D. Naloxone enhances opioid receptor binding. Activated charcoal is a muscarinic receptor blocker. Atropine acts as a cholinesterase inhibitor. The correct answer is A. Naloxone competitively antagonizes opioid receptors. Activated charcoal absorbs toxins in the gastrointestinal tract. Atropine blocks muscarinic acetylcholine receptors. Explanation: scenario analysis. This scenario presents a common yet critical challenge for a specialist in poison information, SPI. The professional must quickly and accurately assess the mechanism of action of multiple antidotes in the context of a potential overdose, ensuring the advice provided is evidence-based and aligns with current clinical guidelines. The challenge lies in differentiating the primary mechanisms and potential contraindications or limitations of each antidote, especially when presented with a complex clinical picture or limited patient information. Misinterpreting or misapplying knowledge of these mechanisms can lead to delayed or inappropriate treatment, with potentially severe consequences for the patient. Correct approach analysis. The correct approach involves accurately identifying the primary mechanism of action for each listed antidote. Naloxone competitively antagonizes opioid receptors, reversing opioid-induced respiratory depression and central nervous system depression. Activated charcoal absorbs toxins in the gastrointestinal tract, preventing systemic absorption. Atropine is an anticholinergic agent that blocks muscarinic receptors, counteracting the effects of organophosphates and carbamates by reducing parasympathetic stimulation. This precise understanding of each antidote's mechanism is fundamental to providing accurate poison information and guiding appropriate clinical management, directly fulfilling the SPI's role as defined by regulatory frameworks that emphasize evidence-based practice and patient safety. Incorrect approaches analysis. Confusing the primary mechanism of naloxone with adsorption would be a significant failure. Naloxone's action is receptor-specific, not a physical binding process like activated charcoal. This error would demonstrate a fundamental misunderstanding of pharmacological principles and could lead to recommending an inappropriate intervention for an opioid overdose. Mistaking activated charcoal's role as a receptor antagonist would also be a critical error. Activated charcoal works by binding to substances in the stomach, not by interacting with cellular receptors. This misunderstanding would negate its utility in cases where gastrointestinal decontamination is indicated and could lead to its misapplication or omission. Incorrectly identifying atropine's mechanism as primarily affecting GABA receptors would be a serious pharmacological error. Atropine's action is on muscarinic acetylcholine receptors, not GABAergic pathways. This misattribution would lead to incorrect advice regarding its use in conditions like organophosphate poisoning, potentially resulting in ineffective treatment and patient harm. Professional reasoning. Professionals should approach such scenarios by first recalling the specific overdose or toxic exposure scenario, even if implied. Then, for each potential antidote, they should systematically identify its primary pharmacological target and mechanism of action. This involves referencing established poison control guidelines, pharmacological texts, and clinical toxicology resources. The decision-making process should prioritize accuracy, speed, and the direct application of scientific knowledge to patient care. When in doubt, consulting with senior toxicologists or referring to up-to-date protocols is essential. The SPI's role is to provide accurate, evidence-based information to healthcare professionals, and this requires a robust understanding of antidote mechanisms. Question 12. The risk matrix shows a moderate likelihood of a specific chemical exposure incident occurring in a laboratory setting, with a high potential for severe health consequences. As a specialist in poison information, SPI, which of the following approaches best aligns with the regulatory frameworks of EPA, OSHA, and relevant international guidelines for managing such an incident? Option A. Rely solely on the laboratory's internal emergency response plan and standard operating procedures. assuming they incorporate all necessary regulatory compliance. Option B. Primarily address the environmental impact by consulting EPA's Superfund guidelines and disregard OSHA as it pertains only to occupational safety. Option C. Prioritize a comprehensive review of EPA regulations for reporting requirements, OSHA standards for immediate worker safety, and consult international guidelines for best practices in hazard communication and emergency response. Option D. Focus exclusively on OSHA permissible exposure limits and emergency response protocols for the specific chemical involved, as it directly addresses workplace safety. The correct answer is C. Prioritize a comprehensive review of EPA regulations for reporting requirements, OSHA standards for immediate worker safety, and consult international guidelines for best practices in hazard communication and emergency response. Explanation. The risk matrix shows a moderate likelihood of a specific chemical exposure incident occurring in a laboratory setting, with a high potential for severe health consequences. This scenario is professionally challenging because it requires a poison information specialist to balance the immediate need for accurate and actionable advice with the complex regulatory landscape governing chemical safety and emergency response. The specialist must navigate the interplay between different regulatory bodies and international guidelines to ensure compliance and provide the most effective guidance. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the relevant regulatory frameworks, specifically the EPA, Environmental Protection Agency, for environmental impact and chemical reporting, OSHA, Occupational Safety and Health Administration, for workplace safety standards, and relevant international guidelines, such as those from the WHO or OECD, for best practices in chemical hazard communication and emergency preparedness. This approach ensures that all legal and ethical obligations are met, from proper chemical handling and storage to reporting requirements and worker protection. It also allows for the integration of global best practices, enhancing the overall effectiveness of the response. An incorrect approach that focuses solely on OSHA regulations would be professionally unacceptable because it neglects the EPA's role in environmental release reporting and potential long-term environmental health impacts. This oversight could lead to non-compliance with federal environmental laws and inadequate protection of the wider community. Another incorrect approach that relies only on internal company protocols without referencing external regulatory bodies is also professionally unacceptable. This is because internal protocols may not be as stringent or comprehensive as legally mandated regulations, potentially exposing the organization to legal penalties and failing to meet the highest standards of public and worker safety. Furthermore, ignoring international guidelines means missing out on valuable, globally recognized best practices that can improve the quality and scope of the poison information provided. The professional decision-making process for similar situations should involve a systematic evaluation of the incident's potential impacts, followed by a thorough identification of all applicable regulatory bodies and their respective mandates. This includes consulting relevant legislation, agency guidance documents, and international standards. The specialist should then synthesize this information to develop a response strategy that is both compliant and maximally protective of human health and the environment. Continuous professional development and staying abreast of regulatory updates are crucial for maintaining competence in this dynamic field. Question 13. The performance metrics show a slight increase in average call handling time, prompting a review of specialist responses. A caller reports ingesting an unknown substance and describes several symptoms, asking for an opinion on what might be wrong and what they should do. As a specialist in poison information, SPI, how should you best respond to this caller? Option A. Immediately provide a potential diagnosis based on the described symptoms and recommend specific over-the-counter medications for symptom relief. Option B. Provide detailed toxicological information about common substances that could cause such symptoms. Explain that diagnosis and treatment are outside the scope of the Poison Information Center and advise the caller to seek immediate medical attention from a healthcare professional. Option C. Speculate on the most serious possible cause of the symptoms and advise the caller to go to the nearest emergency room without providing any specific toxicological details about the ingested substance. Option D. State that the Poison Information Center does not provide medical advice and end the call without offering any further toxicological information or guidance. The correct answer is B. Provide detailed toxicological information about common substances that could cause such symptoms. Explain that diagnosis and treatment are outside the scope of the Poison Information Center, and advise the caller to seek immediate medical attention from a healthcare professional. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a poison information specialist to balance the immediate need for accurate information with the ethical obligation to protect patient privacy and avoid overstepping professional boundaries. The specialist must discern the appropriate scope of their role when presented with information that could be interpreted as a request for medical diagnosis or treatment advice, rather than a request for poison information. The performance metrics, while indicating a need for improvement in response times, should not compromise the specialist's adherence to ethical and regulatory standards. Correct approach analysis. The correct approach involves clearly defining the scope of toxicology services provided by the Poison Information Center. This means acknowledging the caller's concern, providing relevant toxicological information about the substance in question, and then directing the caller to appropriate medical professionals for diagnosis and treatment. This aligns with the regulatory framework for poison information specialists, which emphasizes providing accurate, evidence-based information on poisons and their management, but not practicing medicine. This approach upholds the ethical principle of beneficence by offering helpful information while respecting the boundaries of the profession and ensuring the patient receives appropriate medical care. Incorrect approaches analysis. One incorrect approach would be to attempt to diagnose the caller's condition or prescribe a course of treatment. This is a direct violation of the regulatory framework, as poison information specialists are not licensed medical practitioners and are not authorized to practice medicine. Ethically, this constitutes practicing outside the scope of one's expertise and could lead to harm if the diagnosis or treatment advice is incorrect. Another incorrect approach would be to dismiss the caller's concerns outright without providing any relevant toxicological information, simply stating that it is outside the scope of the service. While it is true that diagnosis and treatment are outside the scope, the core function of a poison information specialist is to provide information related to poisons. Failing to offer any relevant toxicological data, such as potential symptoms or immediate first aid measures, would be a failure to fulfill the primary role and could be detrimental to the caller's well-being. A third incorrect approach would be to provide overly broad or speculative toxicological information without context or qualification, potentially causing undue alarm or complacency. This fails to adhere to the principle of providing accurate and evidence-based information, which is a cornerstone of professional practice and regulatory compliance. Professional reasoning. Professionals should employ a decision-making process that begins with active listening to understand the caller's needs. They must then critically assess whether the request falls within the defined scope of toxicology and poison information services. If the request involves medical diagnosis or treatment, the professional should clearly and politely explain the limitations of their role, and then pivot to providing relevant toxicological information and directing the caller to appropriate medical resources. This process ensures that the caller receives the most helpful and appropriate assistance within the established professional and regulatory boundaries. Question 14. Process analysis reveals that a poison information center is experiencing an increase in calls related to potential occupational exposures. To optimize the monitoring and surveillance of these exposures, which of the following strategies best aligns with regulatory frameworks and ethical best practices for poison information specialists? Option A. Implement a standardized data collection tool that captures essential exposure details, verifies information with callers where possible, and adheres to established reporting thresholds and privacy guidelines for timely and accurate surveillance. Option B. Immediately report every suspected occupational exposure to relevant authorities without further verification to ensure no potential incident is missed. Option C. Rely exclusively on anecdotal information provided by individuals experiencing potential exposures, without implementing any systematic data verification or reporting protocols. Option D. Defer reporting of all occupational exposures until a comprehensive investigation is completed, ensuring absolute certainty of the exposure and its consequences. The correct answer is A. Implement a standardized data collection tool that captures essential exposure details, verifies information with callers where possible, and adheres to established reporting thresholds and privacy guidelines for timely and accurate surveillance. Explanation: scenario analysis. This scenario is professionally challenging because it requires a poison information specialist to balance the immediate need for accurate data with the ethical and regulatory obligations to protect individual privacy and ensure data integrity. The specialist must navigate the complexities of reporting occupational exposures without compromising patient confidentiality or misinterpreting the nuances of exposure reporting requirements. The potential for underreporting or overreporting due to unclear protocols or insufficient training adds to the challenge. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core regulatory and ethical requirements for monitoring occupational exposures. By establishing clear protocols for data collection, verification, and reporting, the specialist ensures that information gathered is accurate, timely, and compliant with relevant regulations. This systematic approach minimizes the risk of errors, protects patient privacy by anonymizing data where appropriate, and facilitates effective surveillance for public health purposes. Adherence to established reporting thresholds and guidelines, as mandated by regulatory bodies, is paramount. Incorrect approaches analysis. One incorrect approach involves prioritizing the immediate reporting of all suspected exposures without a robust verification process. This can lead to the generation of inaccurate or incomplete data, potentially overwhelming surveillance systems and misdirecting public health resources. It also risks violating privacy regulations by reporting unconfirmed incidents. Another incorrect approach is to delay reporting until all potential exposures are definitively confirmed and fully documented. This can result in significant delays in identifying trends or outbreaks, hindering timely public health interventions. Furthermore, it may fail to meet regulatory timelines for reporting certain types of exposures. A third incorrect approach is to rely solely on self-reporting from individuals without any independent verification or standardized data collection. This method is prone to subjective interpretation, potential bias, and a lack of consistent information, making it unreliable for effective surveillance and regulatory compliance. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements for occupational exposure reporting within their jurisdiction. This includes identifying reporting thresholds, required data elements, and timelines. Next, they should establish and adhere to standardized protocols for data collection, verification, and anonymization to ensure accuracy and protect privacy. Regular training and updates on evolving regulations and best practices are crucial. Finally, professionals must maintain a critical perspective, continuously evaluating the effectiveness of their surveillance processes and making adjustments as needed to ensure optimal public health outcomes and regulatory compliance. Question 15. Quality control measures reveal that a poison information specialist provided guidance on a potential overdose of a common analgesic in a 78-year-old male patient with a history of renal insufficiency and congestive heart failure. The specialist's initial advice focused primarily on standard adult dosing adjustments for renal impairment, without a detailed exploration of the patient's specific medication regimen, including over-the-counter pain relievers and potential interactions with his prescribed cardiac medications. Which of the following approaches best reflects the required professional practice for a specialist in poison information, SPI, in this scenario, adhering strictly to UK regulatory frameworks and CISI guidelines? Option A. Conduct a thorough review of the patient's complete medication list, including all prescribed, over-the-counter, and herbal products, to identify potential contributing factors and interactions. Simultaneously, consult specialized geriatric toxicology resources and databases to understand how the patient's age and comorbidities might alter the toxicokinetics and toxicodynamics of the suspected agent, and then provide tailored recommendations based on this comprehensive assessment. Option B. Recommend that the healthcare provider focus solely on managing the patient's pre-existing renal and cardiac conditions. These are likely the primary drivers of the observed symptoms, and the overdose is a secondary concern. Option C. Provide general advice on managing overdose symptoms based on the suspected agent, assuming the patient's comorbidities will complicate the presentation, but not fundamentally alter the initial management strategy for a healthy adult. Option D. Advise the healthcare provider to immediately administer a broad-spectrum antidote for the suspected analgesic, as this is the most aggressive approach to mitigate potential harm in a vulnerable geriatric patient. The correct answer is A. Conduct a thorough review of the patient's complete medication list, including all prescribed, over-the-counter, and herbal products, to identify potential contributing factors and interactions. Simultaneously, consult specialized geriatric toxicology resources and databases to understand how the patient's age and comorbidities might alter the toxicokinetics and toxicodynamics of the suspected agent, and then provide tailored recommendations based on this comprehensive assessment. Explanation: this scenario presents a professionally challenging situation due to the inherent complexities of managing potential poisoning in a geriatric patient with multiple comorbidities. The challenge lies in accurately assessing the risk, considering the patient's age-related physiological changes, potential for drug-drug interactions, and the possibility of atypical presentations of toxicity. Careful judgment is required to differentiate between symptoms of the underlying chronic conditions and those indicative of acute poisoning, while also accounting for altered pharmacokinetics and pharmacodynamics in the elderly. The correct approach represents best professional practice by prioritizing a comprehensive assessment that integrates patient history, clinical presentation, and available toxicological data, while strictly adhering to the established protocols for poison information specialists. This involves a thorough review of the patient's medication list, including over-the-counter drugs and supplements, to identify potential ingestions and interactions. The specialist must then consult relevant, up-to-date poison control resources and databases, applying critical thinking to interpret the findings in the context of geriatric physiology. This aligns with the ethical obligation to provide accurate, evidence-based information and guidance to healthcare providers, ensuring patient safety and optimal outcomes. Regulatory frameworks for poison information specialists emphasize the importance of accurate data interpretation, risk assessment, and clear communication of recommendations, all of which are critical in this complex case. An incorrect approach that focuses solely on the most common symptoms of a suspected substance, without considering the patient's age and comorbidities, would be professionally unacceptable. This failure to individualize the assessment could lead to misdiagnosis, delayed or inappropriate treatment, and potentially severe adverse events. Ethically, it violates the principle of beneficence by not acting in the patient's best interest. Regulatory failure would stem from not adhering to established protocols for comprehensive toxicological assessment, particularly for vulnerable populations. Another incorrect approach might involve providing generic advice without a thorough investigation of the specific circumstances, such as assuming the symptoms are solely due to the patient's chronic conditions without ruling out an acute poisoning. This demonstrates a lack of due diligence and a failure to apply specialized poison information expertise. It neglects the core function of a poison information specialist, which is to investigate and advise on potential poisonings. Regulatory and ethical breaches would include failing to provide a complete and accurate risk assessment and potentially misleading the treating clinician. A third incorrect approach could be to dismiss the possibility of poisoning due to the patient's age and existing health issues, thereby failing to conduct a thorough toxicological workup. This demonstrates a bias against the elderly and a misunderstanding of how toxic substances can manifest in this population. It is a failure to uphold the professional standard of care and could result in a misdiagnosis with serious consequences. This approach is ethically unsound as it prioritizes convenience or assumption over diligent investigation, and regulatory noncompliance would arise from not following established procedures for evaluating all potential poisoning exposures. The professional decision-making process for similar situations should involve a systematic approach. First, gather all available information about the patient, the suspected substance, S, and the circumstances of exposure. Second, critically evaluate the information, considering the patient's age, weight, underlying health conditions, and concurrent medications. Third, consult reliable, up-to-date toxicological resources and databases. Fourth, synthesize the information to assess the risk of toxicity and determine the appropriate course of action, which may include recommending specific diagnostic tests, treatments, or further monitoring. Finally, communicate the findings and recommendations clearly and concisely to the healthcare provider, documenting all interactions and decisions. Question 16. The audit findings indicate a need to reinforce best practices in antidote administration. A 45-year-old male presents to the emergency department with a suspected overdose of a specific pharmaceutical agent. The clinical team is considering administering a known antidote. Based on the specialist in poison information, SPI role within the UK regulatory framework, which of the following actions best reflects the appropriate approach to advising on antidote use in this scenario? Option A. Advise the clinical team to consult with a senior toxicologist for a definitive decision, without providing any initial guidance on the antidote's appropriateness. Option B. Suggest administering the antidote cautiously while monitoring for any adverse effects, as the potential benefits are likely to outweigh any theoretical risks. Option C. Advise administration of the antidote immediately, as the suspected agent is known to be potentially dangerous and time is of the essence. Option D. Recommend a thorough review of the patient's current vital signs, neurological status, and any specific laboratory results that confirm the severity of the poisoning, alongside a check against the antidote's established indications and contraindications before proceeding. The correct answer is C. Advise administration of the antidote immediately, as the suspected agent is known to be potentially dangerous and time is of the essence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the specialist in poison information, SPI, to balance the immediate need to manage a potentially life-threatening poisoning with the critical requirement to adhere strictly to established protocols and contraindications for antidote administration. Misjudging the indications or contraindications can lead to ineffective treatment, adverse drug reaction, or even exacerbation of the patient's condition, all of which carry significant professional and ethical implications. The pressure to act quickly in a poisoning situation can sometimes lead to overlooking crucial details, making adherence to guidelines paramount. Correct approach analysis. The correct approach prioritizes a thorough assessment of the patient's clinical presentation and the specific poison involved against the established indications and contraindications for the proposed antidote. This aligns with the core professional responsibility of an SPI to provide accurate, evidence-based information and guidance. Adhering to these guidelines ensures that antidote use is justified, minimizing the risk of harm from the antidote itself and maximizing the likelihood of a positive patient outcome. This approach reflects a commitment to patient safety and professional accountability, as mandated by the regulatory framework governing SPI practice, which emphasizes evidence-based decision-making and risk mitigation. Incorrect approach is analysis. An approach that proceeds with antidote administration solely based on the suspicion of a particular poison, without confirming the presence of specific clinical indicators for its use, or without ruling out known contraindications, represents a failure to adhere to best practice and regulatory expectations. This could lead to administering a medication that is not indicated, potentially causing iatrogenic harm or masking other critical symptoms, bypasses the essential step of clinical validation, which is a cornerstone of safe poison management. Another incorrect approach would be to withhold a potentially life-saving antidote due to an overly cautious interpretation of a contraindication that is not absolute or is outweighed by the severity of the poisoning. This demonstrates a lack of nuanced clinical judgment and a failure to apply the principle of balancing risks and benefits, which is crucial in emergency toxicology. It could result in a preventable adverse outcome for the patient. Finally, an approach that relies on anecdotal evidence or personal experience rather than established protocols and guidelines for antidote use is professionally unacceptable. This deviates from the evidence-based practice expected of an SPI and can lead to inconsistent and potentially harmful advice. It undermines the credibility of the Poison Information Service and violates the ethical obligation to provide the highest standard of care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, including history of exposure, clinical signs and symptoms, and available laboratory data. This information must then be cross-referenced with current, evidence-based guidelines and antidote monographs to determine if the indications for use are met and if any contraindications are present. Critical evaluation of the risk-benefit ratio of antidote administration, considering both the potential benefits of the antidote and the risks of the poisoning itself, is essential. If uncertainty exists, consultation with a toxicologist or medical professional with expertise in poison management is a crucial step. This structured approach ensures that decisions are informed, justifiable, and aligned with regulatory and ethical standards. Question 17. The evaluation methodology shows that a 4-year-old child presents to the emergency department with suspected acetaminophen overdose. The Poison Control Center has been consulted. Considering the pediatric patient's age and weight, what is the most appropriate initial approach for administering N-acetylcysteine (NAC) as an antidote? Option A. Administer NAC intravenously using a weight-based pediatric dosing regimen, with a loading dose followed by maintenance infusions. Option B. Administer NAC intravenously according to the standard adult protocol, as the mechanism of action is the same. Option C. Administer NAC orally as a 5% solution, ensuring the child can tolerate the taste and volume. Option D. Administer NAC intramuscularly to ensure rapid systemic absorption, as the child may be vomiting. The correct answer is B. Administer NAC intravenously according to the standard adult protocol, as the mechanism of action is the same. Explanation. Scenario analysis. This scenario presents a common but critical challenge in poison information, selecting the appropriate antidote and administration route for a pediatric patient with a potentially life-threatening overdose. The urgency of the situation, coupled with the vulnerability of the patient and the need for precise dosing, demands immediate and accurate decision-making. Factors such as the patient's age, weight, clinical presentation, and the specific toxic agent all influence the optimal antidote choice and its delivery method. Failure to select the correct antidote or administer it via the most effective route can lead to delayed treatment, increased toxicity, or even treatment failure, directly impacting patient outcomes. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical status, confirmation of the suspected toxin, and consultation with established Poison Control Center protocols and evidence-based guidelines. For pediatric patients, specific antidote dosing charts and recommended administration routes, e.g., intravenous, intramuscular, oral, are crucial. The chosen route must consider factors like rapid absorption, bioavailability, and the potential for local irritation or complications. Adherence to these established protocols ensures that the antidote is administered safely and effectively, maximizing its therapeutic benefit and minimizing risks, aligning with the professional duty of care and regulatory expectations for poison information specialists. Incorrect approaches analysis. Administering an antidote based solely on anecdotal experience or a general understanding of adult dosing without considering pediatric-specific guidelines represents a significant ethical and regulatory failure. This approach disregards the pharmacokinetic and pharmacodynamic differences between pediatric and adult populations, potentially leading to under- or overdosing, which can be harmful. It also violates the principle of providing evidence-based care. Choosing an administration route that is not the primary recommended method for the specific antidote and patient population, without a clear clinical justification, e.g., unavailability of Roman IV access, is also professionally unacceptable. This could result in delayed onset of action or reduced efficacy, compromising patient safety and potentially violating guidelines that mandate the most effective and safest route of administration. Relying on information from non-validated sources or personal opinions rather than consulting official Poison Control Center resources or peer-reviewed literature is a critical failure. This approach introduces a high risk of misinformation, leading to incorrect antidote selection or administration, which is a direct breach of professional responsibility and regulatory requirements for accuracy and evidence-based practice. Professional reasoning. Poison information specialists must employ a structured decision-making process. This begins with a thorough assessment of the patient's history, vital signs, and symptoms. Next, the suspected toxic agent must be identified and its known toxic effects understood. Crucially, the specialist must then consult authoritative resources, such as the National Poison Control Center's database or established clinical toxicology guidelines, to determine the appropriate antidote and its recommended dosing and administration route for the specific patient demographic. If there is any uncertainty, consultation with a medical toxicologist or senior poison information specialist is paramount. This systematic, evidence-based approach ensures patient safety and adherence to professional standards. Question 18. System analysis indicates that a poison information specialist receives a call regarding a patient who ingested an unknown substance approximately 12 hours ago and is now experiencing gastrointestinal distress and localized skin irritation at the point of contact. Which classification approach best guides the initial assessment of this poison's effects? Option A. Assuming a systemic effect due to the ingestion route and delaying classification until further symptoms manifest. Option B. Classifying based on the most dramatic symptom presented, regardless of exposure duration. Option C. Prioritizing the temporal aspect of exposure, acute vs. chronic, and the site of action, systemic vs. local. Option D. Focusing solely on the route of exposure and the immediate severity of symptoms. The correct answer is C. Prioritizing the temporal aspect of exposure, acute vs. chronic, and the site of action, systemic vs. local. Explanation. Scenario analysis. This scenario presents a challenge in accurately classifying a poison based on limited initial information. The distinction between acute and chronic and systemic versus local effects is crucial for determining the appropriate immediate management, antidote selection, and long-term prognosis. Misclassification can lead to delayed or incorrect treatment, potentially worsening patient outcomes and deviating from established poison control protocols. Correct approach analysis. The correct approach involves a systematic evaluation of the provided information, prioritizing the temporal aspect of exposure, acute vs. chronic, and the site of action, systemic vs. local. This aligns with the fundamental principles of toxicology and poison information practice, which emphasize understanding the kinetics and dynamics of the poison to guide interventions. Regulatory frameworks for poison information specialists typically mandate a thorough assessment of exposure characteristics to ensure accurate classification and subsequent advice. This approach ensures that the most critical aspects of the poison's interaction with the body are considered first, leading to the most effective and evidence-based recommendations. Incorrect approaches analysis. One incorrect approach might focus solely on the route of exposure without considering the duration or the extent of the poison spread within the body. This is a regulatory failure because it bypasses the essential classification of acute versus chronic and systemic versus local effects, which are foundational to poison management. Another incorrect approach could prioritize the severity of symptoms over the underlying classification, leading to a reactive rather than a proactive management strategy. This is ethically problematic as it may not address the root cause of the toxicity or predict future complications. A third incorrect approach might involve making assumptions about the poison's classification without sufficient data, which is a direct violation of professional responsibility and potentially a breach of guidelines requiring evidence-based decision-making. Professional reasoning. Professionals should employ a structured decision-making process that begins with gathering all available information about the exposure. This includes the substance involved, the route of exposure, the estimated dose, and the time elapsed since exposure. Based on this, the specialist should then determine if the exposure is acute, single or short-term, or chronic, repeated or prolonged. Subsequently, they should assess whether the poison's effects are primarily local, at the site of contact, or systemic, affecting multiple organs or the entire body. This hierarchical classification allows for the most accurate and efficient determination of appropriate interventions and advice, adhering to established professional standards and regulatory expectations for poison information specialists. Question 19. The assessment process reveals a young adult presenting to the emergency department with signs of severe central nervous system depression, including pinpoint pupils, respiratory depression, and unresponsiveness, following reported recreational use of a substance purchased online. The emergency physician requests immediate guidance from the Poison Control Center regarding potential antidotes and management strategies for novel psychoactive substances, specifically synthetic opioids, given the current public health concerns. Which of the following approaches best aligns with the established protocols and ethical obligations for a specialist in poison information, SPI, in this scenario? Option A. Suggests that the emergency department staff consult online forums and social media for anecdotal reports on the effects and treatments of similar substances to guide their management. Option B. Advise the emergency physician to wait for laboratory confirmation of a specific synthetic opioid before initiating any treatment, as naloxone may not be effective for all novel psychoactive substances. Option C. Administer naloxone immediately based on the constellation of symptoms suggestive of opioid overdose, while simultaneously initiating a rapid search for information on the specific online substance and consulting with toxicologists for further management advice. Option D. Recommend empirical treatment with a broad-spectrum stimulant to counteract the central nervous system depression, as the exact nature of the substance is unknown. Correct answer is C. Administer naloxone immediately based on the constellation of symptoms suggestive of opioid overdose, while simultaneously initiating a rapid search for information on the specific online substance and consulting with toxicologists for further management advice. Explanation. The assessment process reveals a scenario where a poison information specialist must navigate the complexities of emerging toxins, specifically novel psychoactive substances, NPS, and synthetic opioids. This is professionally challenging due to the rapid evolution of these substances, their often unknown toxicological profiles, and the limited availability of established treatment protocols. The specialist must rely on critical thinking, rapid information synthesis, and adherence to established guidelines for managing unknown ingestions, all while ensuring patient safety and appropriate resource allocation. Careful judgment is required to balance the urgency of the situation with the need for accurate information and evidence-based interventions. The correct approach represents best professional practice because it prioritizes the immediate stabilization of the patient based on presenting signs and symptoms, while simultaneously initiating a systematic search for information on the suspected substance. This aligns with the core principles of poison control and emergency toxicology, emphasizing the ABCs: airway, breathing, circulation, and rapid symptom management. Furthermore, it reflects the ethical obligation to provide the best possible care even in the face of uncertainty, utilizing available resources and expertise to mitigate harm. Regulatory frameworks for poison information specialists typically mandate a proactive, evidence-informed approach that prioritizes patient well-being and continuous learning. An incorrect approach that focuses solely on identifying the exact substance before initiating any treatment fails to acknowledge the immediate life-threatening potential of many NPS and synthetic opioids. This delay in intervention constitutes a significant ethical and professional failure, potentially leading to irreversible harm or death. It also violates the principle of acting in the patient's best interest when faced with uncertainty. Another incorrect approach that relies on anecdotal evidence or unverified online sources is professionally unacceptable, as it deviates from evidence-based practice and can lead to the administration of ineffective or harmful treatments. This undermines the credibility of the Poison Information Service and poses a direct risk to the patient. The professional decision-making process for similar situations should involve a rapid assessment of the patient's clinical status, followed by the implementation of supportive care measures based on the observed signs and symptoms. Currently, the specialist should engage in a structured information gathering process, utilizing reputable databases, scientific literature, and expert consultation networks to identify the suspected substance and its potential management strategies. This iterative process of assessment, intervention, and information seeking ensures that patient care is both timely and informed, even when dealing with novel and poorly characterized toxins. Question 20. Assessment of a situation where a concerned parent calls a poison information center reporting that their 8-year-old son, who has a known history of asthma, ingested an unknown quantity of a common household cleaning product containing a mild irritant. The parent is anxious and asks for immediate advice on whether to induce vomiting or administer a specific antidote they have at home. The specialist has access to standard poison control databases, but cannot directly examine the child or prescribe medication. Option A. Instruct the parent to induce vomiting as a precautionary measure and then administer a dose of activated charcoal based on the child's estimated weight, as this is a common first-line intervention for ingestions. Option B. Provide the parent with the exact dosage of a specific antidote that might counteract the irritant, based on the child's age and the estimated amount ingested, as this will offer the most immediate relief. Option C. Advise the parent to immediately contact their child's pediatrician or proceed to the nearest emergency department for professional medical evaluation, while providing general information about the potential effects of the cleaning product and what symptoms to monitor for. Option D. Reassure the parent that since the product is a mild irritant and the child is otherwise healthy, no immediate action is necessary beyond observing for minor gastrointestinal upset. The correct answer is C. Advise the parent to immediately contact their child's pediatrician or proceed to the nearest emergency department for professional medical evaluation, while providing general information about the potential effects of the cleaning product and what symptoms to monitor for. Explanation: this scenario presents a professional challenge because a poison information specialist must balance the immediate need for accurate advice with the ethical imperative to respect patient confidentiality and avoid making definitive medical judgments beyond their scope. The complexity arises from the interplay of factors influencing toxicity: age, sex, genetics, and health status, which can significantly alter a substance's effect. A specialist must synthesize this information to provide guidance, but without direct patient examination or diagnostic authority. The correct approach represents best professional practice because it prioritizes providing accurate, evidence-based information to the caller while clearly delineating the specialist's role. This involves gathering relevant details about the patient and the exposure, consulting poison control resources, and then communicating potential risks and recommended actions to the healthcare provider or caller, emphasizing the need for professional medical evaluation. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring informed decisions are made by qualified medical personnel. It also upholds professional boundaries and avoids practicing medicine without a license. An incorrect approach that involves directly advising the caller on specific dosages of antidotes or definitive treatment plans would be a significant regulatory and ethical failure. This constitutes practicing medicine without a license, which is illegal and dangerous. It bypasses the crucial step of medical assessment by a qualified physician who can consider the full clinical picture, including subtle signs and symptoms not apparent to a non-medical caller. Another incorrect approach, such as dismissing the caller's concerns due to a perceived lack of severe symptoms without adequate information, would be a failure of duty of care and potentially violate guidelines regarding thoroughness of information gathering and risk assessment. This could lead to delayed or missed critical interventions. Furthermore, an approach that involves sharing detailed patient information with unauthorized individuals would be a clear breach of patient confidentiality, violating privacy regulations and ethical codes. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and information gathering. Obtain a comprehensive history of the exposure, including the substance, amount, route, time of exposure, and patient demographics: age, weight, sex. 2. Assess influencing factors. Consider how age, infant, elderly, pre-existing health conditions, renal, hepatic impairment, and potential genetic predispositions, if known and relevant, might alter toxicity. 3. Consult resources. Utilize poison control databases, toxicology literature, and establish protocols to understand the substance's known toxicity profile and management guidelines. 4. Risk assessment. Synthesize the gathered information and resource data to determine the potential severity of the exposure. 5. Communication and referral. Provide clear, concise, and actionable information to the appropriate party, e.g., the caller, a healthcare provider, recommending further medical evaluation or intervention as indicated by the risk assessment. 6. Documentation. Maintain accurate records of the consultation,